Okay, when we're looking at the neck, it's really important to get good flexibility in the neck, and we all like that. But I'd like to look at it in terms of flossing the nerves. We've got all this real estate on the side of the neck that's going to be innervating and going down the arms. So if I want to do a floss that's going to have an effect down the arms, I'm going to want to do something on the neck. So I'm going to start off, first of all, just doing a little bit of lateral flexion to see where I go. And those are my restrictions. I appear to be a little tighter over here. And again, I don't really care because I'm going to have to do both sides. I want to get a floss that's going to affect both of my arms. Now, I can't think about doing the neck without thinking about my arms. So what I'd like to do is show a floss that's going to have an effect on the nerve supply for the serratus anterior and for the latissimus dorsi, as well as the lateral sides of the neck. And I'd like to entitle this The Chicken Dance and You. So what we're going to be doing, again, when we do the chicken dance, we're all familiar with that. I'm not going to quite mess up my thumbs that way. I'm just going to put my hands over here. But what I'm going to do in order to help the neck is I'm going to floss by bringing this up and this down. And I put those two movements together like this. And I try to do it nice and slow. And I do 10 of these. I'm at number 3. Here's 4. So this is something that most of your patients are going to have an easy time doing. They might have a problem moving their neck when they haven't added the chicken dance move to it. But when they add the chicken dance move to it, it's going to make a really good difference. So that's what that looks like. Now I'm going to switch to the other side. So this isn't anything that patients find difficult at all. In fact, they're really thrilled to see the change that it makes. So I don't think I've ever had anybody complain about doing the chicken dance. I've had a few people worried when I told them it was the chicken dance. I'm going to call that 10. I absolutely don't know. But let's see. That's how well the neck moves right now. So that was the chicken dance. That's really helpful for the neck. But if I want to do the long thoracic nerve, if I want to help my lat and serratus, I need to do something a little bit different. So what I'm going to do, I'm going to face away from the camera for a moment. And the motion I'm going to do for the lat is I'm going to bring my arm up, and this is where I'm at, except I believe I am currently experiencing a shirt restriction. So let's try that again. Okay, that is where I can go right now. I just fell down a flight of stairs a couple days ago, so I'm a little bit restricted. I have chronic scar tissue in here from an auto accident many years ago, getting run over by a drunk driver. So most people would approach this a little bit differently, but I want to approach it with a chicken dance. So let's see now, if I'm going to do the serratus, I'm going to put my hand here, and ideally when I bring the elbow back, that elbow is supposed to, when I do it passively, come here. I should at least get to my rib cage, but right now this is kind of like a bird. So to apply the chicken dance to this, what I'm going to do is this time, as I come up in a chicken dance motion, I'm going to bring the ear to the same side. So here we go, 10 of these. And again, it's important not to do this real fast. And also, there might be some discomfort, but we don't want real pain happening for anybody as they do this. I know a lot of times in nerve flossing videos, people say, you're going to have some pain, you're going to have some numbness and tingling. There might be some of that, but you want to keep it down to a minimum. So somebody might be able to do only 3 of these to start with. And I like to work up to 10. Now, a lot of times people like you to do 3 sets of 10. I'm not in that camp. I like to keep it at 10, and again, I like to keep it as a floss. Let's see if that made any sort of a change here. So I'm straight out, and I'm thinking that's a little bit better back there. I don't know if I helped on my serratus or not, but that's where I'm at. I'm thinking that helped. So that is the chicken dance, and it can help the sides of the neck, and it can help that long thoracic nerve. I would imagine it would have helped anything going down the upper extremities. I just didn't test everything.
Thank you so much.